When an optometrist looks deep inside your eyes, what they're looking at is the health of those fluid-filled spheres that are connected to your brain. But did you know your eyes are windows to so much more?
So actually the eye can be a really interesting conduit in terms of your overall general health.
Yes, it is.
If we take a bigger, broader picture and we look at diseases such as if you're a diabetic, for example, a lot of blood leaks tend to occur on the retina.
That's because diabetes thickens your blood. The higher your A1Cs, the thicker your blood, and thick blood puts tremendous pressure on arteries and blood vessels.
The blood vessel wall actually breaks down, and you can get leakages onto the surface of the retina. So if you imagine if you have holes in your holes while you're watering your garden, somebody comes along and cranks the pressure up. That's the combination of high blood pressure and diabetes.
In other words, those tiny little blood vessels in your eyes rupture and they start to leak.
You can actually have a lot of bleeds on the retina, which can cause problems with your vision. Actually, diabetic retinopathy is the #1 cause of vision loss in the working age population.
When it comes to diabetes, constant monitoring is extremely important, not just for your eyes, but for every vital organ in your body. Far too frequently, undiagnosed complications from diabetes do not present anywhere other than your eyes. When the optometrist peers inside your eyes, they're also looking for signs of glaucoma, another debilitating health concern.
How we develop glaucoma, which is when the optic nerve, which is a nerve that sends a signal to the brain, how that nerve degenerates in certain folks and not in others.
Interesting new evidence is pointing towards blood pressure, low blood pressure, something you almost never hear about. Dr. Quaid, working with a research team at the University of Waterloo, has identified that low blood pressure plays a significant role in the onset of glaucoma. The team has gone on to examine the relationship between low blood pressure, glaucoma, dementia, and Alzheimer's.
There is some interesting evidence out there to show that there could be a correlation between things like Alzheimer's and dementia and glaucoma, although that's still being debated.
In other words, is glaucoma an early warning sign for dementia and/or Alzheimer's? That research continues. However, there is an abundance of evidence that suggests regular eye examinations play a role in the maintenance of your health.